Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before measuring blood glucose, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Good morning, sir.
Good morning.
I'm Ashley. I'm going to be your nursing assistant today.
Hi, Ashley.
May I check your armbands?
You can.
And can you please tell me your name and your birthday?
My name's Bill Rotter. My birthday is 12/29/51.
Okay, thank you. I'm going to be checking your blood glucose.
Okay.
Okay, I'm going to go grab all my equipment and I'll be back.
Okay.
All right, thanks.
Before measuring blood glucose, arrange the equipment you'll need on your work area. Raise the bed to a level that provides for good body mechanics. After you have helped the person into a comfortable position, put on gloves. Next, prepare the supplies. To do this, open the antiseptic wipes. Remove a reagent strip from the bottle. Place the strip on the paper towel and put the cap securely back on the bottle. Prepare the lancet. Turn on the glucometer. Make sure you have the correct reagent strips for the glucometer you are using by comparing the code numbers on each. The numbers should match. And follow its prompts. For instance, enter a user ID and the person's ID number. If needed, also scan the barcode on the bottle of reagent strips. Next, perform a skin puncture to obtain a drop of blood. For this step, first inspect the person's fingers and select a puncture site.
Just to protect your bed a little bit.
Then warm his chosen finger, rubbing it gently or applying a warm washcloth. Also, massage his hand and finger toward the puncture site and lower them below his waist. These actions increase blood flow to the site. Insert a reagent strip into the glucometer. Using the thumb and forefinger of your non-dominant hand, hold the person's finger. With an antiseptic wipe, clean the site. Don't touch it after cleaning. Then let the site dry. Next, pick up the sterile lancet and place it against the puncture site. Following the manufacturer's instructions, push the button on the lancet to puncture the skin. With a gauze square, wipe away the first drop of blood. Apply gentle pressure below the puncture site and let a large blood drop form. To continue, collect and test the specimen, following the manufacturer's instructions and your agency's procedures for the glucometer. For example, hold the test area of the reagent strip close to the blood drop and lightly touch it to the drop. Don't smear blood on it. The glucometer will test the sample when enough blood is applied. Using a gauze square, apply pressure to the puncture site until the bleeding stops. If the person is able, let him apply pressure to the site. Then read the result on the glucometer display and note it on your notepad or assignment sheet. Tell the person the result and turn off the glucometer. Next, discard the lancet in the sharps container and discard the gauze squares and reagent strip according to agency policy. Finally, remove and discard your gloves and practice hand hygiene. After measuring blood glucose, perform post-procedure care. For example, put on gloves and disinfect the glucometer, following the manufacturer's instructions. For detailed information, see the section on follow-up care, reporting, and recording in this program.